Hello, my name is Shannon Morgan. I'm program manager at HealthHIV. Welcome to today's podcast, Second Chance Voices, Peer Leadership in Sexual Health and HIV Education, sponsored by the Effie Berry Training Institute. The Effie Berry Training Institute is funded wholly or in part by the government of the District of Columbia, Department of Health, HIV/AIDS, Hepatitis, STI, and TB Administration, also known as HOSTA. April is recognized nationally as Second Chance Month, a time dedicated to supporting the successful reentry of individuals returning to their communities. In recognition of Second Chance Month, this episode honors the resilience of returning citizens and the importance of equitable access to sexual health and HIV prevention and care. Through the voices of those with lived experience, we explore how education, trust, and community-led efforts are creating meaningful second chances and improving health outcomes in DC. For additional training related to today's podcast, go to effieberryinstitute.org, where you can find the Stronger Futures, Reentry Support for Black Women with HIV module, and a fact sheet titled Key Strategies and Community-Driven Approaches to Addressing Incarceration, HIV, and Black Women in DC. I'm joined today by Lawerency Boone, Public Health Advisor and Reentry Community Health Worker at HOSTA, and Robert Stevenson, Peer Outreach Specialist for the DC Department of Health. Can you both share a bit about the type of work that you do?
Good afternoon, and thank you. So yes, I'm a community health worker, reentry community health worker here at DC Health. Primarily, my role is to assist and find individuals that are lost to care, that who are living with HIV. I am deployed at DC Health and Wellness Center right here off of 77 P Street in the People's Building in Northeast. So that's one of my in-house tasks. I assist the doctors if they have an individual who's been out of care for a while. I'll pursue outreach efforts to assist that resident to get reconnected and re-engaged into care. I also have the privilege of partnering up with Department of Corrections, and I'm allowed to facilitate groups at the jail, health and wellness groups, with the pretense of providing sexual, but mainly HIV education and information about PrEP. However, we went under the health and wellness guise so we wouldn't be stigmatized and lose our audience before we started. So we do groups at the jail. We recently just partnered up with Adams Place Shelter, and we're looking forward to trying to also do groups at 801 Shelter. But that's what we do as far as engaging the residents and in the community. But we also do outreach efforts as well. We table events. We do HIV testing in the community. That's how we can directly engage with our community and make direct contact with them. And we generally provide them with swag and things that kind of bring them to our table so that we can engage our community and educate them in real time.
Mhm.
And Robert, can you tell us a little bit about the work you do?
Okay, yes. My name is Robert Stevenson. I work for the DC Department of Health. Our building is right here, 2101 Shannon Place Southeast. Basically, I do mostly outreach. And I want to say to everyone that I am someone with lived experience, so we all know what that means. In this particular case, one of the groups, I guess, or individuals that I do deal with is returning citizen. Of course, in my outreach, I deal with people with substance use disorder, mental health, homeless, anyone in DC metropolitan area that's having some kind of issue or crisis along those lines, whether it's HIV testing, hepatitis. I kind of like link and refer them to testing for communicable diseases, bloodborne diseases, whatever I can do on a daily basis. That's basically what I do. Of course, also I go to different community centers. I was certified and trained by the DC Department of Health to do things like domestic violence, anger management, conflict resolution, substance use, mental well-being. I was trained in the basics on HIV prevention and hepatitis C, all those things. So I want to say to everyone on a daily basis, that's kind of what I get and what they get from me. And I want to just mention this. The beauty of it is, it's like a lot of those things I have experienced myself. So people kind of listen to me, and the things that I haven't experienced or don't know, I usually link or refer them to someone. For instance, like if I run into a person that want to get tested in real time, I will put them in the cab. I'm sending up there to Mr. Boone on P Street. I hope I gave you a good example of what I do.
Yes, you did. It sounds like you wear a lot of hats. Um, so what would you say are some of the biggest health challenges that returning citizens face?
Okay, I'll go first, Launchy. I mean, for me, I think it's like the basic kind of stuff, hypertension for individual coming from that environment, hypertension, mental health, substance use, all those things are there. And I said I was waiting for this opportunity just to share this with you. It's that for me, in my experience, I had the information because I saw it while I was there. Something happened to me. I had routine surgery, just briefly, for a hernia. And while I was in the outside hospital, they took a pre-surgery blood test and came back and said, Mr. Stevenson, do you know that you have hepatitis C? I'm like, what? I've been locked up 15 years. Nobody never told me this. So what happened was I went back to the institution. They told me, Mr. Stevenson, we didn't know. You never requested a hepatitis C test. So just briefly, what I'm saying is that this go on with a lot of returning citizens because what happened is they've been there for years, and if they do not request an AIDS test, a hepatitis C test, they come back out with the same diagnosis that they had when they went in. The only reason why they would basically try to find out is that if they had symptoms. So
Right.
my thing for right quick is that I advocate when I get an opportunity to talk to people in the jail, the brothers in jail, I tell them to get tested. The
Hmm.
only mandatory test that they have in the Federal Bureau of Prison is the tuberculosis. That's a mandatory test upon lock when you're being incarcerated. It's mandatory that every single human being get tested for tuberculosis. So why we can't do that for all the other things?
Yeah, because if you don't know to ask,
Right.
then it's not going to happen,
Yeah,
right?
see, they just not gonna
You
take
don't
your
know what you
blood and
don't
let you.
know.
Yeah, they're not
Yeah.
gonna do it. If they
Yeah.
do it, they ain't gonna let you know they took your blood,
Hmm.
right? But
Right.
thank you.
Oh, I'm a piggyback of Robert. I think that was a brilliant insight as to it, because that's not even a misdiagnosis. That's just not even the person being diagnosed at all. However, I want to add to that. I believe that one of our biggest health challenges for our returning citizens, it is not per se a health challenge, but it's a problem with them pursuing health consistency or compliance. So I like to say housing instability. Housing instability is huge with our population for so many reasons. One of the main reasons is medication compliance, right? And I'm not even just going to talk specifically about HIV, but for any medication, right? One, if you having housing instability, is a good chance you live with people around others. You might don't want to disclose your medical regimen to those people, so those are disclosure issues. Then you have issues as far as consistency, because a lot of people that have housing instability tend to do couch surfing or they're going to shelters, so just keeping up with their belongings is a task, right?
Hmm. Right.
So that could be quite troublesome. But also, uh, connectivity to the resources. So some people, because you have levels of housing instability. Some people have some people to stay with, and some people have no supports at all. So they're looking for emergency shelters, things of that nature. And of course, you're talking about now travel. So now, if I'm staying in a shelter, if I don't have funds to house myself, the likelihood that my transportation resources are slim to none. So staying connected to the medical system with that's like one of the hugest gaps as far as staying connected. And education. I'm gonna say education because again, what you just said was one of the biggest pieces. If you don't know, you don't know.
Right.
However, ignorance is not an excuse. Right. And so and that's the reason why we are so proactive. That's the reason why we are in our community because we need the community to know what's going on, especially with themselves. So that's the purpose of us tabling events, being in the community so that we can encourage the community to be more proactive in terms of their own health.
Well, that being said, with the education that you offer, what are some of the common misconceptions about HIV and sexual health that you have found among justice involved communities?
So the common misconceptions about HIV is that it's still a death sentence.
Mm,
And with it being a death sentence comes, or with the 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 mindset being that it is a death sentence, because I want to be accurate with what I'm saying. But mindset of it being a death sentence comes along stigma, right? So stigma is what we tend to face. So, but the misconception is that that you can't live a healthy life, right? For me, that's one of the things that people just don't tend to know about HIV. So instead of running to get tested, they avoid testing,
right,
right?
because they don't realize
Because
that
they
there's,
don't realize that this
yeah.
is something that's very treatable and you can live a healthy life with it. So due to the either lack of information or the misinformation, that opens up so much room because again, not knowing instead of, it produces fear, right?
Hmm.
It produces fear. And I'm talking about this. Think about it. I didn't want to be stigmatized as the facilitator of HIV education.
Right.
So imagine someone who has a HIV or who's been diagnosed with HIV. They have all kind of apprehensions, especially in
Mhm.
this environment, because that kind of environment, you don't want your information getting out there because now you're labeled and stigmatized. But I believe that the biggest misconception is the part as far as about the education, the knowledge thereof, knowing about it. I mean, because I too, I came from a DOC space before I came to DC Health. So when I came to DC Health, I had to learn everything HIV related, and it was some great information because it was things that I didn't know. I too was not educated as far as all of these medications that now exist. Like you had at one point, you had to have just a pill regimen. And again, a pill regimen probably wouldn't work for someone that has housing instability. However,
Exactly.
if there's education given, I can say, well, we have a bi-monthly injection. Oh, here's a every 6 month injection. So now it's like, well, now I can be in compliance because when I get out, I can go straight to my doctor, get an injection, and whether no one has to know what my medical regimen is because it's already inside of my system. So,
Right. And I'm going to guess that they also don't know about PrEP to help prevent.
the misconception of PrEP is the marketing.
Yes.
Right? So when I'm in the jail and I'm asking guys, are you interested in PrEP? The majority of them, their original response is no, because on the commercials, they don't see themselves
Hmm.
identified in that marketing group, right?
Right.
When they look on the screen, they see MSM men. So they associate it as this is something that's for MSM men, not for heterosexual men.
Right.
So
Right.
we have to again break down those birds as well as do better with our advertising.
Hmm. Yes, I agree. I agree. Robert, what about you? I mean,
Okay, I
what
want to add
what
a couple. couple of things to what Lawerency was saying about the misconception. A large one is that, and I'm talking guys like myself, uh, we have a tendency, or I did, think that the disease was far away from me, meaning that it was for, no disrespect to anyone, it was for gay black men. It was
Mhm.
for gay black men exclusively who got AIDS or individuals that inject drugs. So a
Mhm.
large part of the population do not consider themselves a part of that group. So not understanding that AIDS can and do happen to all kind of people.
It does
But
not discriminate.
right, no
Yeah.
discrimination. But
Right.
a lot of guys, and I say brothers, but a lot of guys think that because they're not gay and they're not injecting drugs, then they're cool or they're all right or their
Mhm.
status is safe. But for me, and I'm someone that spent a lot of time in that environment through the years, I would like to see condoms given out. Now, this not to mean that everybody in there dealing homosexual acts, no, but at least they would be available as a prevention method for guy. Maybe if you go to sick call, you could pick up a couple, put in your pocket. If you lived like that, I'm saying, like Lawrence said, a lot of things could be kind of like proactive to help on the prevention side. You see,
Right.
so and a lot of guys had the stigma about that, like man, the whole thing, and the rate of AIDS is high, meaning that I don't think how a person can be there and not know somebody that has been taking the medication or somebody that has been recently diagnosed in those institutions. So for me, it's like the medicine is available only if a guy wants it, you see? But a lot of time they're worrying about the stigma. So
Right.
like Lawrence said about PrEP, and I'll say it later on, and I used this example before, back in the day, we didn't have that. So now
Mhm.
it's possible to live a normal, long life health-wise by keeping your viral load suppressed and U equals U, all this kind of stuff. So I'm saying that's what I usually express to a lot of the young men when I go into the jail. Largely go into one of the jails, I go into the central facility in the substance abuse unit, and we talk about everything. AIDS, substance abuse, mental health. I mean, it's supposed to be an anger management class, and we talk about everything. But yeah,
Okay. Yeah. Okay. Well, I mean, I know we've talked about housing instability and we've talked about transportation and stigma. And of course, those are all barriers to accessing HIV testing, PrEP, or treatment after release. Are there any other barriers that you can think of that might affect any of those?
I think.
Yes, I'm going to
Well,
say the barriers are the mindsets, right? And you talking about after release or just
After
period?
release, yes, after
Okay.
release.
So, recently I did a group and I kind of did a poll because I wanted to see how the guys in the inner city may think. And of course, this is not it's not a it's not a blanket for everyone, but just the guys that find themselves either recidivating through the criminal system. But just I want to kind of take a poll. So my question was, how many of them actually gauge their sexual um, their sexual health through the women that they deal with, right? Because as we all know, there's a huge disparity when it comes to black men and their own health.
Hmm.
And a lot of that is because of a lack of education, a lack of understanding, but it is self. It's a lot of us doing it, right? Because men, for some reason, men don't feel like it's okay to not be okay. So we're not as proactive to pursue bad results, if that makes, because that's people just look at hospitals not as saviors, they look at it as negative. This is where I find out what's wrong with me, not what's right with me. So I noticed that a lot of men don't have a connection to the medical system
Right.
already. right? So when their woman goes to the doctor, they're highly vigilant. They ask her all the questions. Baby, what did they say? What did what do we have? What you know what I'm saying? So
Hmm.
if
Yeah.
she comes back and she gives nothing but a clean bill of health, it's a two-party diagnosis.
Right. Yes. Yes.
Right? And that's one side of it. The other side is like Robert was just saying, in the federal system they don't really test you for everything. However, DC government is set up a little different. DC jail is set up different. They do STI testing and HIV testing upon entry, right?
Hmm.
So most guys who may have never checked their status, right? They now know their status. They know whether it's negative or positive. In which case, if it's negative, I know that this isn't the most smartest thinking, but they're like, hey, I got a clean bill of health. I know what's up with me. I'm good. It's like having brand new paperwork, right? And instead of going out there and say, hey, I'm going to be even more mindful, I'm going to be more protected and use condoms, they feel like I can go wild. And that's something, now that's one of the biggest things we have to get in front of, that
Right.
thinking, right? I think that that's one of the barriers that's huge is the thinking and the lack of connection for us directly with our own care. We
Hmm.
tend to not have a relationship with our doctors or our bodies. And that's huge. The barriers for PrEP, I would say the same for the most part. We just talked about as far as uh, the audience in which you're pitching it to. I think the education piece is helping because guys understand like that this can't really prevent you from catching HIV, but it's still not as publicized to the target audience that we want. So, and then as far as treatment, most people pursue the treatment, but the ones that have the hugest barriers that I'm aware of are the ones that are homeless. Like
Hmm.
recently I had a guy that was extremely hard to find. So I started pursuing him through his email. We started to converse through the email. However, was able to engage him one time before seeing him on the unit that I facilitate groups. So naturally, when I facilitate groups, we end up talking. I mean, I have them almost like in a childlike state. That all the distractions are removed from them. So I'm getting able to engage him fully. And he was released on a day before the group, and I didn't get a chance to get any contact. But this is the thing, I make sure that they have my contact information because it is a two-way street.
Right.
However, I don't have access to him. So upon his release, I don't know where the brother went.
Right.
It's really, there's no way for me to track him. I'll go to his house, I'll make the same calls. So now it's like I'm repeating the efforts that I had initially started before even engaging with him in the jail. So to
Mhm.
me, that is one of our hugest challenges because once they're released, they're just released.
Right.
And I mean, I don't think that they prioritize treatment when they're looking for somewhere to live.
Yeah, I agree. I mean, they're surviving, right? That's the most important thing is survival. Um, so, you're in your education. I mean, I think this is where your education comes into play in a big way and what you do for these individuals. How do you build trust with these individuals who may have had negative experiences with healthcare systems? Because I think that is another huge barrier.
You want to go first, Robert?
Okay, and then I wanted to add one thing on the barriers. I think for a lot of guys coming out, one of the barriers is transportation, just getting to and from a testing site. So, and then the other thing is their priorities. So, you get out, and these are the kind of things that Lawerency and I talk about when we're in the jail. The first thing, you have to have your priorities together. You want to start doing that before you get out. You want to have everything kind of like schedule of
Mapped
what
out.
things you need to take care of immediately. So
Hmm.
HIV testing is important. You got your status. So you want to be on top of that depending on need. But like I say, transportation to and from the clinic, those kind of things have to be established early on. All right. You asked about the trust. Now,
Hmm.
and for me, I was thinking about this last week when I saw that question. For me, the thing about trust, what I found out on the community is that people go with what you say. So you have to represent what you say. So I usually tell people, don't take my word for it, check it out. So if you're consistent in what you're saying and the information and the resources you give prove to be correct or factual, that is a sign of trust. Plus, the other thing that for Lawerency and I, we have lived experience. So when they see us, they trust us because they know we've been through some stuff or
Right.
we've been through a few things related to all of this. So I usually share, and I seen it somewhere in your question, I usually share my negative and my positive experience. And usually, and most of the time in my case, the good outweighed the bad. So I share that in real time with them and just let them know that, because they know and they have experienced it, I'm sure, themselves. And one thing I wanted to mention too is that when we was talking about the barriers, is that a lot of folks know their status. And it's like I talk to guys all the time in the community. I say, man, look, you out here, you using substances, and most folks that use substances have or may have mental health condition. So for me, I try to explain to them that their inhibitions about sexual behavior, sexual conduct is lowered or not at standard. You ain't considering that. So all these things come together. So I usually try to associate how you living is based on how you living, because a lot of people don't live like that, then they don't have to deal with those barriers, you see?
Can I add to it? I definitely agree with Robert. I wanted to add that how do we develop the trust? And I believe that we develop that trust by organically, right?
Hmm.
We don't come in pretentious. We don't come in being someone other than who we are. And our ability to relate to the audience that we deal with, or that we serve, excuse me, um, it calibrates the system, right?
Hmm.
And on top of that, on top of being organic, we show them one that we care because they can feel that in the
Right.
sincerity, but also showing them something different. If you keep doing the same thing and getting the same results, we were told that that was insanity.
Right.
So why we keep doing what doesn't work,
Right.
right? So human engagement is how trust is developed, right? You just come in, you be yourself, you tell people what it is, what you offer. You stay laser focused, and while also providing a humanistic experience.
Right.
A lot of times our audience are talked at and not to,
Yes.
right? So you have to meet people where they are and give them what they need. See, a
Right.
lot of times we lose people by telling them what they need and what they should have when the person that knows their needs best is them. And you can't come in thinking you know what someone needs without engaging them. It's like so disrespectful.
Hmm.
So
I agree.
and then our audience have been disappointed so much, even disappointment of self. So their trust system isn't strong. So you are combating something that's already in existence, and the only way to do that is to give them something new, something different, but
Right.
something real. And that's why I started off with organic.
And developing those relationships.
You have to develop those relationships. And what I mean by that is, typically, you might not have someone that's going to go to the doctor with you,
Right.
right? Well, we have the ability to go to accompany you to the doctor. We'll call you. Hey, don't did you forget about your doctor's appointment? Like, man, Mr. Moon, not even in the. He keep calling me. Maybe I'll go. You know what I mean? Like just knowing someone cares. So that
Hmm.
means a lot, and it goes a long way.
Or having an advocate. I mean, that's so important too. Some people don't know how to advocate for themselves in the healthcare
Mhm.
system. So that's great that you can accompany them. So how do you talk about prevention tools like PrEP, condoms, and routine testing in a way that resonates with returning citizens?
Well, I'm
And don't hold
fortunate to.
back. Don't hold
Okay,
back.
I'm fortunate enough to have a males group, right?
Mhm.
So I don't have to do a lot of censorship in my group. And
Right.
I encourage people to be themselves. I have a major saying, allow people to be who they are and you'll get the best out of that person.
Right.
So again, I don't promote raunchy groups. However, I promote you being able to be yourself and express yourself in the way that you know how, because we encourage participation. So I'll say, how do we talk about prevention and prep straight up? So I'll use relatable story imagery. Okay. I'm fully aware that men have good intentions, but my uncle used to always say the road to hell is paved with good intentions. I mean, you might have good intentions, but if you don't
Yeah.
follow through, it's just left at good intentions. So I'll use a statement like, I know you like I use storytelling a lot of times in my groups. So I'm like, well, and I'll invite them. How many of us have went to a female's house with that one good intention condom in your back pocket? Right? So that's how you do. You invite the group in and guys' hands will go up. And then like, man, what you mean by good intention condom? I'm glad you asked. That's the condom that you had in your pocket for good measure. You had no intentions on using it, but if she alerted to you having a condom, you could seem like you're responsible,
Right.
right? And then
Right.
when the group erupts in laughter, I know I have a relatable bunch, right?
Exactly.
So from their own admission, I can now start talking about the fact that you're not being preventative. You're not protecting yourself.
Right.
We all relate. Then I'll go even deeper because as I'm sharing that story, you'll have the guys giving me more relatable insights. Well, what about when they take the condom off, Mr. Boone? I was going to get there. You start off with the condom on, you
Right.
take them 2 strokes, and next thing you know, you done peeled the condom off, hoping she doesn't mind, but you had no intention of using it anyway. So I go through all of
Yes.
that
Yes.
because I have to address the poor behavior, the incorrect behavior before I can address the correct behavior. But I also need to know that they can relate, right? So
Right.
once I know that we can relate, we're engaged. We're
Right.
engaged. So now so what can we do to prevent that? Because
Hmm.
obviously we don't like using condoms. They're like, well, Mr. Boone, I don't really like using condoms like that. Well, there is something that you can take. And so so right now, the communication about PrEP is easy to disseminate. What the questions that I get about PrEP is like the long-term effects,
Of
how can
course.
the adverse effects, things of that nature. And I'm just straight candid with them. I tell them what's shared with me about the nodes and things of that nature. I still share about the importance of using condoms, right? And naturally getting tested. I I try to shock them with certain facts.
Hmm.
Right. So we talk about HIV, but then I might talk about chlamydia or something when we talk about sexual health. And as most people know, you can have chlamydia and it's be asymptomatic for months to years. Then I start asking questions like, do you realize how many people you've had sex with in 2 months or 3 months?
Hmm.
So can you imagine the rate of spreading a disease? And then you involve them in the process. And in doing that, we hope that they're getting an understanding. But
Right.
as far as the tools that we use storytelling, or me personally, I use storytelling. I use relatable stories that they also can relate to. Yeah. So
Yeah, I think that's really helpful for healthcare providers to understand that this is how you meet your clients, right? Yeah. What about you, Robert?
Uh, I use that same technique, and like I said, usually I do outreach, and I'm usually in all of the exciting areas in the city that have those kind of activities going on. And it was reminding me this morning I was up there on T Street, and I was going through this past this house that I was checking out because they had reports of sex work there. So when I went past the house, I seen a young lady and a guy there. So I rode around, came back around. So I pulled up near the curb, and she gestured for me to come to the door, right? So I said, no, 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 no. And my point is that usually when I talk to returning citizens, like Lawerency said, a lot of the guys, I usually use their their past experience. So, it's an assumption amongst us that most men in them situations have experienced, whether a serious or minor situation with some sexually transmitted disease. Whether it's, gonorrhea, chlamydia, syphilis in some cases with no symptoms. So, in that population, a lot of guys, I don't know about the women, like Nancy said, but the men I knew firsthand have experienced certain disadvantages when they had that kind of behavior. So I use those as an example of how and why it's important to use condoms and to use them correctly.
Hmm.
So, and part of that, Lawson made me think about it. So I pass out condoms. So a lot of the young men out here, so I'm passing them out. So the first thing they say, well, do you got any magnums? So
Right.
that's what that's what they ask for. I say, look, man, let me explain something to you. And I'm an old man. I say, an average condom can basically fit a small watermelon. So you don't need no magnum. You just need to protect yourself, right? But I usually
Yeah.
use, like Lawrence said, because it seems like they can relate to that, and it's really in real time kind of thing. Because a lot of them, and like I said, it's different in the community now than what it was when I was young. Meaning that the opportunity to find yourself in a sexual situation, not to discredit anyone, seem like it's more available, more easy, especially if you're in certain environments, right?
Hmm. All right. Let's move on to how community-based organizations can better support returning citizens in accessing HIV prevention and care.
So I'll start. I think that community-based organizations can provide, or you say, be more support to returning citizens by being more knowledgeable of what returning citizens face, the barriers that they face. When I was at DOC, I had the fortune of participating in a simulation. It was like a returning home simulation. It was very interesting and very insightful. Um, they actually involved most of the administration, some COs as well. It was, I think, if I'm not mistaken, it was mandatory. And we all got an opportunity to actually be returning citizens, right? And each person was presented with certain barriers, like you had a certain form and you had to go do certain things strategically. So I might have to go see my PO, and then they might say, go to this food bank, and then it'll say, go pick up. And each stop, you had to use transportation. Right. So that means you had to actually have transportation or you had to get the monies to get transportation. Well, just say it was very challenging for most, and most of the administration ended back up in jail because of all of the barriers that they face in just doing their day-to-day, their day-to-day requirements. Because when
Hmm.
you get released from prison, you have things that you must do. You got to go see your PO. They may send you to a place for like community service. It may be something you got to do over here for rehab for so many hours. But then you got to participate, and you're still looking for employment, right? In the midst of
Right.
all of this. However, you could not transition from one space to the next space without a traveling ticket. A traveling ticket costs money. Sometimes you ran out of money. You had to go to the church to see if you can. Man, some people had to go to the blood bank because
Hmm.
they wanted to get some money just to travel. I mean,
Right.
so it was, although
Eye-opening.
oh, yes, although
Right.
assimilation, it illustrated the significant barriers and the frustrations. It was so comical because I too am a returning citizen. So for me, this was a real life scenario to
Mhm.
see
Right.
these, like some of these circumstances, some of these situations, scenarios. However, to see these administration and these individuals who have never experienced this get frustrated, even in jest, even in like you say, even in the simulation, and we know that it's not serious. You can just see the frustration. Some people was literally wanting to quit. Well, guess what?
Right. Because they didn't want to go back to jail, right?
I return residents. If they quit, they're back locked up.
Right.
Right? I
Yeah.
don't want to go see my PO. I'm not doing all this. Well, if you don't do any of it, now you're in non-compliance. So I think that what our CBOs can do is build rapport where you have a better understanding of the need. If you have never experienced this, the need is not as great. You don't understand the necessity of these needs, right? But I think that that was a great way to illustrate the not just the barriers, but the difficulties, the frustrations, just the whole gamut of what's associated. I mean, you saw people getting emotional in there. Like the frustration was, it was an eye opener. It was an eye opener, and I think that was great for a lot of the COs because it gave them an opportunity to look at our citizens or our returning citizens slightly different because they
Yeah.
now have experienced, even if in that short period of time, they experienced some of what they experienced
And
when they return home.
I can imagine that they started to recognize what the needs of returning citizens are, right? And what kind of support services that they are require in order to be successful.
And that's how ideas are generated,
Mhm.
right? Because now we're like, well, if they need that, maybe we can now have someone that assists them with smart trips when they come home because we know smart travel is a major component for them to access the city. Like, the average time when they release you, they don't release you with, some travel funds. I think they give you one smart trip, and that smart trip is generally going to get you from A to B, and after that, if you have no support system, you have a very challenging time coming home.
Yeah.
Mhm.
What about you, Robert? What do you think community-based organizations could
Well, I
do to?
always like to, in a case like this, I like to use an example. Okay. So for returning citizens, and I usually ask the guys this, I said, what is the number one reason returning citizens, uh, for the recidivism rate, the reason for them going back to jail? What is the number one reason? So they tell me different things, but they never pick. But the data say it is the number one reason. The number one reason why they go, I mean, the main reason people go back is for technical violations. So Lawerency and I know this technical violation, not making appointments, not doing seemingly the basic stuff, not being rearrested, just trying to do what your case manager or parole officer tell you to do. So guys don't do that. They don't meet the timeline. So in terms of HIV, assessing HIV prevention and care, I'm advocate that this should be part of, like Marcy said, the training that we receive. When I came home, I went to Mocha. They showed me how to get my ID. They showed me how to register to vote. Those things, HIV prevention and care, should have been a part of that.
Yes.
All that should have been part of the program. So It shouldn't have been left out for me to find out on my own. So there should have been resources and awareness available, whether there was handouts. All for me, all of that stuff is part of integrative care. All that should happen together. You shouldn't get bits and pieces. It should be one process to safeguard not just a return to citizenship, but everybody.
Hmm.
Integrated care, physical, mental, substance abuse, all that together.
One-stop shop.
There you go.
Yes.
True wraparound services. A lot of our CBOs always say wraparound services, but what I'm starting to realize with a lot of these quote unquote wraparound services is like almost like referrals on top of referrals on top of referrals, right?
Hmm.
And that's also frustrating to a
Right.
returning citizen. I'm coming here looking for a job, an opportunity. I get here, you offer me more referrals. So that means I have to now go here. What Robert just said made so much sense. That's why places like Morca, places like the Ready Center are so beneficial in our community because instead of having to go to travel 5 places to get 5 different services, I can come to one location. I think that that is a major component of assisting our returning citizens because if I can get an ID, I can get connected to food stamps, I can get sign up for a work training program. I can also get considered for a vocational cohort. I can do all of those things in one place. Then I have saved time, money, and energy, which is the system, right? Save yourself time, energy, and money. But the
Hmm.
reality is, in most places, not set up that way. So you will have to have a token or some kind of transportation to get you to the DMV. So then when you leave, and mind you, it's a time constraint too, right? Because as you know, you go to the DMV, you can't gauge how long you're going to be there. So now you're at the DMV 2, 3 hours. You might have started there at 9 in the morning. When you leave there, it's 12. Now you're trying to make it over to DHS for food stamps and Medicaid, right? So now you get there at 1:30. Oh, the line is ridiculous. You may not even be able to get into the building that day because the line was so crazy that morning, right? So now you're talking about a wasted effort. Can you imagine that? Traveling somewhere with limited resources and I get there and they tell me come back tomorrow like I have additional funds. Sir, can you come and when residents start feeling like they're being spent around, they get frustrated and they just don't want to start. They don't want to do it anymore. So, um, I'll definitely put that one-stop shop, clustering services for our returning citizens so that they can get more than one service in one location. That will be ideal for our returning residents.
So these locations that you said do kind of a one-stop shop.
So Morca,
But
Morca is definitely one, and Ready Center is also another. Yes.
so when it comes to community-based organizations that provide HIV prevention and care, um, do you think that that would be a good partnership for them? I mean, it sounds like you feel like that would be a good partnership with those
Well, I think it would
organizations
be
that
great.
provide all these other services.
Well, I'm gonna tell you what I would think would be great. So if you had access to HIV prevention and care, so if you have access to it, what I would recommend is to have someone there that deal with like medical service, medical insurance, like someone from DHS, right? That makes sure that your insurance is up to date.
Right.
Right. Then you can also now talk to this person. We have HIV testing right there. We got we got STI, STD testing. We want to make sure you like I think everything if it just makes it simple. It
Mhm.
simplifies the process. I mean, because the process
I
they're gonna have
agree.
a process regardless, right? But to simplify that process. And can you imagine if I come in there? I might have just came in for an ID not knowing that the rest of this stuff exists. I
Right.
leave with food stamps, or at least register for food stamps. I leave at least registered for my Medicaid and Medicare. Um, I now have signed up for a cohort, and the cohort might not start until June, but the ball is moving, right? I also
Mhm.
signed up for a job program. So you like, but when you leave out of that space, you don't feel depleted and defeated. You feel accomplished what you set out to do when you came out of the house. A lot of these places, you'll get up. have the, because you coming out with this positive knack and you want to make it happen. And instead of leaving accomplished, you leave depleted. You
Right.
leave people with people talking to you crazy, not giving you the best services, and not providing you with the greatest insight. So, great customer service, all that stuff goes a long way.
I can imagine. I can imagine the frustration would probably make people want to just give up. So, but thank you both. This has been a great conversation. As we close today's episode of Second Chance Voices, Peer Leadership and Sexual Health and HIV Education, I would like to thank our guests, Lawerency and Robert, for sharing their experiences, insights, and the important work they are doing to support returning citizens. Today's conversation highlighted the significant health challenges many individuals face after release, including barriers to accessing HIV testing, PrEP, and HIV treatment, as well as other essential healthcare services. We also explored the critical role that trust, lived experience, and community-based support play in improving engagement in care and advancing health equity. For healthcare providers, public health professionals, and community organizations, this conversation serves as an important reminder that reducing stigma, building trust, and creating accessible, person-centered systems of care can have a meaningful impact on the lives of returning citizens. As we recognize Second Chance Month, let us continue working towards communities and healthcare systems that support dignity, opportunity, and equitable access to care for all. Thank you for listening and for being a part of this important conversation.